Hi everybody, I am Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with facial balancing as well. I'm going to walk you through this particular patient, this case right here. This is a patient that I did a few different things here under a single combination session, which ended up actually just looking incredible just in a matter of a couple months for him. So take a look. You can see, I'll wait for a few more people to join on because we had some audio issues earlier and then a streaming issue earlier. So I'll wait for people to kind of rejoin here and hopefully it'll work. Let me know if you're having issues again still because I've been trying to get that fixed. Let's see, hopefully it get fixed a little bit there. Apparently there was a lag and some issues there before. So let's see, hopefully it's sounding okay and everything. And I can just kind of go through with this case. Okay, perfect. It looks like it's working okay for everybody here. So yeah, so this is a patient. He comes in all the way from Texas. I treated him a single time for this case. And he is actually somebody who did a bunch of things before he came to me. And it really just was feeling like he was hitting a wall, wasn't getting much improvement in his skin. And I really appreciate the fact he's letting us share his full journey here. So you can see this is one of these trust the process type of photos. You really look at when you see this. Actually, I'll zoom in a bit here so you can really take a look and see. Although actually I don't want to, maybe I'll keep it a little bit smaller because I don't want people to say it's graphic content there, but it shouldn't be. I mean, it's just like medical, it's just, there was an open wound, which we ended up really, because it was really, really thick scarring there. I had to do ablative CO2 laser actually for that, to actually smooth that down. It took several bits of using that CO2 laser to actually just keep on working on that, those thicker parts of the scar. You can see when you look at his skin, there were areas where it was thick right there. And then we also had to do talar liberator subcision in his case, Noker needle subcision for him. I also did excisions. There were these large boxcar scars that actually take out the scars, and we removed. And then we did another round, a bit of more laser there under a single session. And then I also placed a little bit of Bellafill for this patient. Sorry, no, actually Sculptra for this patient as well. So a few different steps really for him, and incredible improvement actually already. What are the drawbacks of laser? Well, there's a few things. I mean, you can see when you're looking at this, there's still, there's a 2 months out. In his case, he still has hyperpigmentation. This is not a permanent form of hyperpigmentation. It's already a lot better than where it was earlier. It's going to continue to get better. He's just not nearby me. So, otherwise I could use a Pico laser. So it's he's going to use creams right now, and if he wants to, I could always use a Pico laser. But 2 months out, he's a patient who is of Vietnamese origin, and he had thick scars. So for him, pigmentation is not really a problem. In the short bit right now, it's no big deal. Some people it may be, and we're going to talk about that. We'll talk about what you're trying to achieve, what kind of results you're trying to achieve. And no, it's Gabe. Hey Gabe, how's it going? By the way, this is actually under a single combination session for this particular patient. So it's a single combination result for this patient. Saya is saying, hi, what topical treatments can I buy which will reduce the appearance of my acne scars? Mine are really colored and have hyperpigmentation. So you could do something where you could get Eucerin's anti-pigment cream, and then at nighttime you could use Differin cream. So Differin, that's like just a topical retinoid, and then you could use Eucerin anti-pigment cream, and that could potentially help you out with that. But it may need more robust treatments, potentially like lasers or peels, things like that that could work out for you. Tough to say, I haven't seen you, but that's something over the counter that could help you out with there. Shaman's saying, have you heard of the latest incident with Juvalook? Yes, I did. It's really interesting actually, because there's been a few cases actually. I'm in a smaller group where physicians kind of report some adverse events, things like that. And then something actually else just happened where somebody had injected, actually that was, I think, Skin Vive. And the Skin Vive, which is just basically a little bit of a skin booster, and they cause an occlusion with that. And I've seen now several actually occlusions with just topical, with these skin boosters, some in the forehead even, and along the nasolabial fold as well. So it's riskier than people expect, and people may think that just these are quick treatments that they could just do, but there's a risk involved with these injections, and it has to be done a certain way. I do 1 to 2 cases of forehead filler every single day, and it's really every single day we do it that way. I'm very, very careful with that. Very, very careful as I do it. But there's ways of really making sure that we could do it safely. I use cannulas for the forehead area, moving my cannula around constantly, not putting too much pressure in there, and that's how we could do it safely. But there's places where it could, on the face where it could actually go into the vessel, and then you could run into problems. And unfortunately, very, very unfortunate that person ended up getting blindness from filler, juvenile caused blindness, and there's certain products that are a little bit less likely, certain things like, for example, Sculptra, a lot of it's very dilute, very low likelihood of it going into a blood vessel. Even Bellafill, if it's done properly, a proper way, it's a very thick product. It'd be very difficult to go into the vast majority of vessels. Sure, certainly certain vessels, if you go in there really directly into with a needle, it's possible, but low likelihood actually of that. So certain products, it's less chance of it actually than other ones. Hi, Mrs. Jones. Good seeing you on. Thank you so much for coming on, and appreciate your kind marks as usual. Appreciate you. How to address hyperpigmentation after acne and trauma to the skin. So in this case, really what we're going to do is more skin lighteners. And really he's just going to be using our pigmentation cream for right now, I believe. And then a lot of sunblock in his case. And that's going to lighten it up. If I need to, I could always escalate it to with lasers like the Pico laser, things like that. And so that's really the process really for his kind of pigmentation. For hyperpigmentation after acne, like PIH, that sometimes actually just gets resolved with sunblock and just like a low level, just a lightening cream. Like I was talking about before, Eucerin's anti-pigment cream could work out really well for people. It's better than you may expect actually. Kofi, is good seeing you on, Kofi. Kofi saying, you mentioned this was a single session. Dr. Qazi, if you don't mind sharing, how much was the total for this session? I can't say specifics for each individual patient because that really wouldn't be fair to the patients. But it will be most patients $5,000 to $7,000. But if they need more volume replacement, as this patient did, it could go from $10,000 to $12,000 for some patients under that single session there. Kofi's also saying, also, I hear you say on the live sometimes that it's a long process and we must be patient, but after 3 months for this result is not bad at all. Thank you so much. Yeah, I mean, that's what I want to show. I want to work on someone like you, Kofi. I want to work on patients like this, actually. So I want people to see, though, that sometimes there's some pigmentation afterwards, and it's important to recognize that that's part of the process sometimes. For some people, it's not all the time. It's just I don't have it many, many times over a couple months or so. It's really cleared out, but it could happen sometimes. You could still may have a little bit of hyperpigmentation. So I want to show that. I want to showcase that for you guys because I do want to just have this so that people are understanding what's involved here. And even when I do share it though and do show it though, still there's some people that seem to think that if it does happen that it's just a disaster, and it's just not a disaster. It clears up. Where have you seen these things where it just hasn't cleared up? I clear it up. And it's like there's a way to do it, and there's a way to do it safely over and over and over again. And it's like, what are you trying to achieve though? Are you trying to get really the best possible result? Are you going to allow me to help you achieve the best possible result? Then we could get there. Look at this patient trusts me completely. He's somebody who, from the beginning, from day one, when we did the consultation, just was just like, let's just like whatever we need to do to get this. He was just frustrated with his scars, frustrated of how it looked on him, and he wanted to get the best possible result for himself. And he was hoping to do that. So he flew in all the way from Texas to be able to do that. I took it very, very seriously to be able to do that. But this same kind of patient, if he was let's say we did this and he had a little bit of pigmentation, some people, there's a patient actually who was just tying up her phone lines really for weeks and weeks and weeks, and was just over and over, like a matter of just after we did it, just a week later, always reporting that there's there's pigmentation, there's this, that. It's like there's going to be sometimes a little bit of that. We're going to work on it. We will give you the creams to do. We'll work on everything else that needs to happen here, but it's a journey. It's a process here. So somehow it's like something shifts in people though sometimes, where like they do these things, they want to work on getting the best results, but they also just don't want any pigmentation issues even for a short period of time. And yes, there's certain things we may be able to do then for you. Like we could maybe do volume, we could do subcision, we could do TCA cross, but we certainly aren't going to get this kind of results if you're looking for that. So I just have to explain that to you. There's certain ways that we can improve certain things if it's just from volume loss, things like that. Of course, we could still get some improvement for it. And if you're like somebody who's just totally risk averse, then sure, that's what we could consider doing. But I also don't really like, I only do 3 cases, 3 to 4 max is 4 really, 3 cases a day. And I have a limited time in my life where I'm going to be doing this. And I just like, I want to help the people that want to help out, really, so it's like the people that are stressed out about like things like where, that they're concerned about this that much, where it's like that they feel like they just can't be able to handle that. It's like better not to do this, or go to somebody who's going to do like the Clear and Brilliant 20 times, or do the microneedling 20 times, or like, any of those type of things, and see how that works out. And then like, I'll be able to treat the people that really need work, like this patient. I have a patient today, she flew in all the way from Montreal today, and she actually has stage 3B ovarian cancer, which is a very, very difficult prognosis. Very, very difficult, and really wonderful patient, really, really wonderful. And she was saying that she just like, even though she knows that she may not be here for very long, she just wants to look better. That's what she feels like. She just wanted to look better, wants to have more confidence in her face, in her skin. She never got a chance of having that while she was healthy, and she's young, and she has stage 3B ovarian cancer. And she came all the way from Montreal just to be able to experience really great skin. And I really want to help someone like that, instead of people that like are gonna like stress too much about like the process over a month or so. I'm happy to help you during that process, but like it has to be within like a reasonable amount, like really. And there's ways of doing this where we could do this very, very safely, and I'm going to walk you through and help you over and over and over again. But I also need people to help me out and be like the right space to do this. Be the right time, and like do this properly, and do it when you feel like you're comfortable in your life and you're like everything else is okay. And this makes a lot of sense for you, because there's a lot of people, and even if there aren't people I have a lot of pro bono stuff that I'm behind on. I have a lot of people that I need to help out with. Like literally, there's a lot of people on my list of people that I still have to do, that I'm doing pro bono stuff. So it's like, I have a lot of things that I have to work on, and a lot of other projects too. So it's like, I would really much rather do that than like work on people that, that are going to be stressed about things that are not, that are just unreasonable stress there, and it puts an unreasonable strain on like everybody else too. So I would much rather work on something like this. Is this a CO2? Part of this was CO2, but we did subcision, we did excision. So subcisions where I went underneath the scar tissue, broke up the scars. I did excisions, physically remove the scar, and we did subcision also with blunt cannula and also something called Taylor Liberator. And then we also did lasers as well, the CO2 fully ablative in certain areas, fractionated laser elsewhere. So we did a few different steps really to get to this actually. And then we also placed a little bit of Sculptra there. So we did a few different things right there. Eduardo, good seeing you. Eduardo is going to come to us on Friday. Good. Thank you so much, Eduardo. Thank you so much. Shaman is saying, if someone has no skin concerns and just want a general glow up, what procedure would you suggest? Well, lasers are awesome, honestly. You could just do a micro peel. I love it. It's one of the best. Like we do this laser that's a micro peel, just like tiny little bits of the skin that we could actually just exfoliate really nicely with the laser, or even the Pico laser could work very, very well for that too. So those things are awesome. Just lasers are just like nothing beats it, honestly. Does TriLuma work? TriLuma could work, yes. It could be a really good option for a lot of patients. I just don't do it too early on because I find that sometimes it could actually be too reactive, too irritating. It has a little bit of steroid in there too, so I usually don't do that also for very long either. So that's why I usually don't do too much with TriLuma for these patients there, especially when we're talking about scar patients. Can you tell me what is the most effective treatment for boxcar scars? Vinod is asking the most effective treatment for boxcar scars. There's a few different things really. We could do a little bit of subcision, so just little small spots just for those little each individual boxcar scars. Sometimes we could actually do a little bit of Bellafill as well, so we could just lift that up a bit with Bellafill. In today's case, what I did, that patient that came in from Montreal, I did laser to soften up the edges a bit there, which works out really, really well too. So a few steps, but actually you can see a lot of times I also do TCA cross in boxcar scars. It works very, very well. You just have to use the right concentration, the right spots there for it, but it can actually work very well. And you can even get some scar contraction that way. What are our prices? Our prices are actually on our page at drqazi.com. You can just go to see at drqazi.com right there. Shar is saying, can't wait on my May 30th for my treatment. Are you doing TCA, Bellafill, and laser same day? I look forward to seeing you too. I will be doing that. Yes, I do that the same day many times. And the lower part of the face, I usually don't do volume though on that same day though. So if it's on the lower part of the face, I probably don't do. But you can see for this particular patient, most of his issue is really in the mid cheek area. So that's why I ended up working with for him. MK is asking, hi, Dr. Qazi, how much is subcision? It's not listed on your site. That's because it really does vary. It could be anywhere from $800 sometimes to $2,000, depending on how many excisions we're doing and how extensive the scarring is for the subcision, how long it's going to take, things like that. Gabe, it won't hurt. We'll do a lot of numbing, really. We do a lot of injections to make sure it's comfortable. Sometimes men really do require more numbing, and sometimes there's a little bit of anxiety too, so we may need anxiety medications too. Look forward to seeing you though, Gabe. Look forward to on Wednesday. I feel like it's been a few months that we've seen each other, so that'll be awesome. What do you think of endo lift? I think it looks pretty cool. It's something that, there's a couple things though that I do think that it has to really be with some sort of fat really removal, because otherwise if you're just doing it just with the skin tightening part, you're not really, I don't know what you're going to end up doing about that fat that's going to pull down. It's not going to last very long. And the other thing is that sometimes when you're going in there and you're melting fat, it can get hard actually afterwards. So I do see that people are doing it without removing fat, and I feel like that's not something that's going to be great for patients. It's probably not going to last very long. Jasmine is saying, is Bellafill temporary? Do you have to re-inject every so often? Well, 20% of it just continues to stay there really. We know at least for 5 years. I know for many patients, it looks pretty much semi-permanent, almost permanent really for many patients. And you likely are just going to always have that PMMA. But as you lose your own natural fat, you likely have to put a little bit more of that Bellafill in there. So we're talking 5-10 years of a product there, and you're losing a little of your natural fat there. So you have to do something to support that natural fat, and that could work out well. Amanda is asking, what do you think about suctioning after subcision? I don't really see much benefit to it. I really don't. I think that there's likely more trauma that's involved with it. I don't do it when I do these laser procedures also, because it's just the amount of friction that could end up occurring. It could end up causing it so that it gets too, the scab peels off too fast too. So I wouldn't really recommend doing that either. Kofi's saying, for a large range of ice pick scars, would TCA be too tedious for you, or does it matter, or is there a better way for multiple of ice pick scars? Yeah, we could do multiple. I just do a bunch of I do whatever I could do for the ice pick scars or the boxcar scars with TCA. As long as it's safe for me to do, I'm going to cover it there. So I'll do it. I'll just keep going at it. So as long as it's safe. But there's a way to do it, and sometimes I just don't feel like it's going to be worth that risk, and I may not do it there, or there may be areas where instead of doing it that way, I may try to get it in the inner wall to get a little scar contraction, things like that. So not necessarily at the base of the scar. A few different tricks. It just depends on each kind of scar. But yeah, it doesn't matter. There's no amount of scars that I would be like, oh, this is just too many for me to do. I'm just going to do it all. I'll do all of it. So I'll take care of it. James saying, hope you can post some videos or before and after results with Pico laser on pigmented skin. We have so many. Most of what I started with was pigmentation. So take a look and see. You'll be able to see a lot of my results actually on our page with pigmentation. We have a lot of results for pigmentation. In fact, we have a lot more actually that we probably are just way behind on that we have to post up there. Vinod is saying, is there a difference between punch excision for ice pick scars and excision for boxcar scars? Well, it depends. Yeah, sometimes we do an elliptical excision where we actually try to make it more narrow. That could work very, very well for wider scars. Work very, very well for that. And punch excision, we could just literally take out that scar completely there. Ake Hero saying, if I want to get fat graft for tear troughs, should I be on my target weight? I'm trying to gain weight. Yeah, you should pretty much always be on your target weight when you're trying to do things that are like plastic surgery type procedures, especially with fat transfer. Try to be close to your target weight. Losing a little bit of weight here and there is okay, but just really it should be slow though. Emily saying, when should we start getting preventative Botox? When you have movement. Whenever you have movement, you should do it. As soon as you have some movement there and you feel like there's some lines and contraction there, feel free to do that there. Charlie saying, I'm 2 months post fourth session of a cure, but haven't seen any result. Do you have any suggestion? Are you my patient, Charlie? Because I always do follow-ups with our patients to make sure that there's always some progress there. I'm not sure if you are or not, but usually I have to adjust some things that, well, and especially there's the thing that lags a lot of times is the bacteria on the surface of the skin. And as we started clearing up that bacteria, then you really start seeing a lot more of that improvement as the sebaceous gland reduces. So I'm not sure if you're one of my patients or not, but that's typically my protocol. So if you are one of my patients, feel free to reach out. Oh, you're not my patient. Okay, yeah. So I do have a different protocol than a lot of offices. Honestly, I'm pretty aggressive with the bacterial component of acne. I found myself, my own skin, that the biggest thing was really controlling that bacteria. Oil, of course, was a really big factor, but the bacteria component was really a critical aspect there. And so I usually use topical creams to really get it under control in my patients. And then a lot of times you still want to be on like a low dose form of a retinoid as well. Hope to see some more pictures of phenol peels of realistic results. Yeah, we had a while where people weren't letting us share, but over about a few weeks ago, we had a few patients that let us share some phenol. So when they're ready, probably in about 3 more months, it'll probably be ready to post something, and you'll see exactly how we always do with our consistent lighting and everything. You can be able to see what the realistic phenol result is. I think it's really important to actually see that what is a realistic result. There's a lot of things, a lot of confusion about what is realistic, and I see it all the time on my page too, where people are showcasing these things, and it's like a week out or so. And I don't believe in doing that. It's just really confusing for people, and they don't understand that you have to do so many different steps to them when they're doing phenol. And it's like, there's a way to do it really carefully. Es el mejor, Dr. Qazi. Me encanta su trabajo. Appreciate you. Thank you so much. Luis Enrique is saying, can TCA make the scar worse? It could, sometimes. It could definitely make it worse if the person is doing it is not steady. If there's a lot of oil production too, sometimes it could happen. But if it's oil production, it's usually just a short temporary type of thing, and then it contracts over time. No, I'm not Persian. Yeah, I saw some results on TikTok. It is like 100% clear. Yeah, and I mean, the thing is that, here's the thing. So I do, really, I'm not saying this as like a way to brag or anything. I'm just like, it's just a fact. I do the most amount of acne scars in the world. It's just a fact. It's not like a thing, it's just a fact. I do the most amount currently in the world. I do 3 to 4 cases every single day of bigger combination sessions. There's nobody else who does that many. And it's not like, and I take my time doing it, do a lot of work with it. And it's really clear there's a certain way that we could have these results. And there's you see patients, and I do phenol peels, all these things, and it's just not true that it's going to be this 100% type of improvement that they showcase. Let me just put it that way. It's just not true. And it's not, there's still, you still see some scarring. Still, you still see the texture. Still, still could see volume loss if they're not solving volume, things like that. So when do they get the photo after the phenol peel? That's the big question. When do they get the phenol? When do they get the photo? And is the photo with, consistent lighting and if they're just, they're trying to push the phenol peel and they're not showcasing that, it's like, you have to really think about it yourself. That really doesn't make sense that over here, I'm showcasing that you still have scars, and it's not, there's not anything else with it. Really, it's just that you still will have some scarring. You still will have volume loss if you didn't solve volume. There's just no way of getting that perfect type of look really with a single phenol peel like that. There's no way. So what does that mean? It means that, there may be like swelling there. There may be other things that are happening there. And that's why you're seeing that kind of result. So I'm not sure why they do it that way. I'm not sure why they push it over and over again, because clearly it's not going to be like, that's why maybe they don't feel comfortable going on live every night, because they know that it just can't last. That kind of thing, you can't really have people just walking around and making it seem as if it looks like it's perfect when it's not perfect like that. It can't be. Like I showcased that it's not perfect. It's not perfect. These results are not going to be, the scarring isn't going to get perfect like that. Sometimes it's like pretty close. I think it's pretty close. Patients think it's pretty close, but like you can still see a little bit of texture, still see it. And if you're not seeing any texture in this stuff, it's like, it's questionable though, right? Like I do so much of it and there's still texture afterwards. There's still some scarring afterwards. And it's like, okay, these guys, I think you have to really question it sometimes. Do you prefer laser work or peels for deep scars? It depends. Really, either one's okay. Sometimes peels has this utility though, especially for deeper, thicker rolling scars. Scars along the boxcar scars along the neck area works very, very well for that. Deep phenol peel could work very, very well for that. I did a TCA peel the other day on a patient with boxcar scars. She's a lighter skin type. I did that because that works really well for those. It works really, really well for that. It was relatively superficial too. It was like, did a little bit of Bellafill, dip TCA peel, it's going to work really, really well for it. So there's a lot of different options. I could absolutely do peels or absolutely do lasers. It just doesn't, it's about what the patient needs. That's why patients just like what I do, my whole thing here is that I just want to have it so that I'm not bound by these companies and I just give you the best possible treatment plan. And the thing is that like, whatever needs to be done, I'll just do it. Like, it just like has to be done that way. And like, let's just get it done that way properly. And that's what this whole thing is about. This is about trusting the process. That whole this is a process. This whole journey is a big process here. And it's like, I think you should really question a lot of the people that are showcasing stuff where it's like, you know, people are saying, well, can't you get like these perfect results with phenol? Why can't you just do phenol over and over? It's not going to be perfect. It's just a one tool. It's a way to resurface the skin. It looks awesome. It looks killer. It could be a really great tool for the right kind of scars, for the right kind of patient. It could be awesome, but it's not really the way to do it for a lot of patients. It's not important. It's not appropriate for a lot of patients. There's some people where there's somebody who does phenols all the time on patients with very mild scarring that could be solved safely in, with lighter lasers. And they're doing an Asian skin type. And I've helped with their patients afterwards that have had a year and a half of redness after they did strong phenol peels on them. I mean, that just sounds like that's very, very inappropriate. You know, like we could get the same result without that kind of downtime. Why would we subject a patient to a phenol? You got to ask yourself, like, what's the reason why? Alexis, yes, I saw a lot of questions. I missed a lot of them though. So let's see here. You said, so do you know why darker skinned people experience more hyperpigmentation when getting microneedling? Well, there's still going to be a stimulation of the melanocytes. So really, that's one aspect. But more likely, there's just this trauma to the skin. It's this redness, and afterwards, really, what could end up occurring is just a little bit of sun exposure could cause it to get hyperpigmented. So that's also possible as well. Jason is saying that he's a little bit worried about Bellafill. What filler is least risky? Well, they all have risks though, Jason. So you could, like this patient, we did Sculptra. You could consider doing Sculptra. You could consider doing that. I say Bellafill because it worked out really, really well for me. I love Bellafill on my own face. I love it. It's made me really happy looking at my skin, looking at my scars, looking at my face. It looks really, really good. But I honestly don't want to push anybody to do anything with any of this stuff. So it's like, if you feel like, you don't want to do Bellafill, sure, but do something for volume. So volume could be like Sculptra could be an option. Radius could be an option. Radius is a calcium-based product. It goes absorbed, completely by your body. So you could consider that. Those are options. I like Bellafill because I just liked it on my own face. It worked out really, really well. And I knew that people just didn't, when people were saying, don't do it, don't do this, blah, blah, blah. It's because they just didn't know, like I saw their hands. I saw how they were doing. I saw the way that they were injecting. I saw the way they do filler. I saw their aesthetic. I thought that was garbage, a lot of them. Really. I think a lot of people out there that talk about the stuff, that have these things, that talk about like, giving volume and doing filler, things like that. I think they have a lot of them, like, I wouldn't trust them with my face. I wouldn't trust them with like a product that's easy to dissolve. I would never trust it. I wouldn't trust like anyone I know with that stuff too. So like I was looking at it like, maybe I should stop trusting these things and like get my own hands on these products and try it myself with my own methods and see how it looks and see how it makes sense. And I knew that like my own skin, I knew I had volume loss, and I'm otherwise, like I'm a skinny person, so any little volume loss is really, really bothersome to me. It gets really hollowed out pretty quickly. So it's like Bellafill worked out really, really well for it. So that's why I ended up doing Bellafill. Bellafill was like amazing for me. But like, I understand if someone like, okay, I read on like, online forum where they were saying that, there's a risk of Bellafill, blah, blah, blah. And it's like, okay, like, sure, then then come up with something else for volume replacement. Like I said, Sculptra could be an idea. Radiesse could be an idea. That's fine with me. So it's up to you if you want to do it that way. I just like Bellafill because it worked out for me, but I don't mind doing Sculptra. I think it's awesome too. But like, Sculptra is a different product. It's going to be like, there are going to be like where you can maybe feel firm for a few months, and people could be bothered by it. I have a patient, she's bothered by the fact that she has to push down to get it, but she has to push down and she feels like there's a firmness there. It's going to go away. It goes away. But like, some people get bothered by that. And it's like, just, there's different things that like, everything has its like pros and cons with all this stuff. And again, you have to feel like you're in the right space for this stuff. I do think that people just have to be in the right space for a lot of things. I'm going to get you really killer results. Like, I really will. I will get you killer results. But like, mentally, like physically, you just have to know what you're going to go through. This patient right here I'm showcasing is just a wonderful person, amazing patient. He just totally understands the whole process and just knows that it's going to be like a process, a journey. And he just wants really, really good skin, and was totally down for it. Just like, do whatever we need to do to get this so we can get better. And as long as I'm like, he knows I'm going to be safe, I'm going to be careful with him. I'm going to do everything I need to do to get him to where he needs to be. And we'll get there. So that's like what I'm shooting for. I'm shooting for that all the time, really. I'm going to try to get excellent, safe results for patients, but I also expect patients also to just like trust that process. They're coming to me, like, you're coming all the way out here. Like, I just, I showcase over and over and over again. If you have questions, like, let's talk about it, because it's like, I show it over and over. Zuri is saying, do you offer any courses? I'm a beginner esthetician in New Jersey and really want to specialize in corrective skincare. Well, I do it for physicians, but I would not be able to do it for estheticians though. And sometimes for some PAs or nurses that are interested in certain things. But I'm really, really booked up right now, so it's really tough for me to do any more trainings for anything. But like, yes, there's some aspect of training. So just if you happen to get like your nurse's license or PA license, then we could maybe consider doing more of these kind of scar treatments though. Sophia is saying, I'm planning on traveling to you for the Cure Laser. Any tips on how to reduce oil and cystic acne until then? Well, control your diet. Really make sure that you stop inflammatory products or inflammatory food like dairy products. Really make sure that you quit that. Really make sure that you're cutting out like just like certain inflammatory food, products. Also like saturated fats, for example. Complex sugars. Just really think about like junk foods, anything that's just been sitting there in like these bags and stuff like that. Like that's food. It's just probably not edible, probably not great for your body, not great for your skin, going to cause you to have a little bit more oil production. So start with that. Actually start with diet, drink more water, start taking omega-3s. Actually could work really well for you. Zinc, 50 milligrams of zinc works really, really well. So consider all those things. Appreciate all of you guys, by the way, and I'll be happy to help you with answering more of these questions with you as you have. It looks like there's a lot of questions that people are having about like their treatment process. I'll be on this week, so I'll be happy to answer those. And I appreciate everybody else that wants that's shooting for training, things like that. I always appreciate you guys. Thank you so much for coming on to and messaging me. I do see, I'm really behind with like catching up with some of the training requests, but it's just that we are really busy, and I don't want to have it so that my patients have to wait because I'm training somebody or doing anything else there too. So it'll have to be a little bit of a different process for that. Triple X is saying, are there any new things you are going to add to your practice for acne scarring? I keep an open mind. I'm always open to things. It's just a lot of things have just been very disappointing to me. Nothing's been like just like wow, like this is going to be something I really have to jump at right now at this moment. To be honest with you, nothing's really like just sitting there like wow, this is something I just have to just to bring on. Like we don't have this yet, and I can't wait to have this on board. Everything else has been pretty much the same. To be honest with you, it's not really much of a difference. Gabe, yeah, there's a lot of, Gabe is asking about do a lot of patients have anxiety? There's a lot of patients that have an anxiety beforehand until we start working on them, and then they usually are okay. But anxiety could be a big challenge for patients, so we may have to give an anti-anxiety medication to help out with that. Or you could do Pronox. Some people just love Pronox as like the laughing gas that you could use while you're sitting here. You could do that. Where can we post pics that you can give recommendations on images on live? Yeah, you could go to our forum on drqazi.com. There's like a area where there's a community area there, and you can submit it there. I will try to get to them. Sometimes I get to them eventually. There's like an area where we have like a free live assessment area. And take a look at that. Actually, the ones that were up there already, I did go through those ones for people. So take a look at the forum there, and I can help you out there actually. But yeah, of course, do a consultation. I'll just go directly and tell you exactly. Can you get rid of the hyperpigmentation from the laser? Yeah, absolutely. He's gonna go. It's already probably gonna get cleared up. I just adjusted a few things for this patient. Probably another couple of weeks, it's going to be even more clear. So we'll see him again in a little bit of time and give a progress report there. Let's see here. Isabel saying, is microneedling recommended for someone that flushes around the face? It may not be great. It may actually cause more rosacea there. Who would you recommend for in London, UK? I've seen a lot of the work over there. There's maybe one person that I can't remember offhand now that I started to see that was doing some things, but then I did hear of some other patients that went to physicians over there. A lot of patients in the UK, by the way, a lot of patients, and they kind of have informed me that really isn't too many people that I could recommend just offhand out. But I'm open to things. I think that it's worth taking a look and seeing if people are picking up and improving their skills and improving the way they do things. I think some people were very, very dangerous though. And in the UK too, they were very, very dangerous with some of the stuff they were doing. And I hope that's changed. I really do. Because there's some things that were going on that just like, I think that it was giving a bad reputation for a lot of people. And really, I hope that things progress where we no longer are seeing that. Do you know anyone in Toronto? Well, a lot of my patients come from Toronto. A lot of people try a lot of different things in Toronto. I can't say really that there is somebody over in Toronto, but I think probably for certain things potentially, like maybe for like some people maybe for TCA cross potentially, but I'm not sure about like more like this combination type of thing. And they certainly are somebody that could do some things though, and maybe it'll be like a few different physicians or so, something like that. Strawberry Milkshake is saying, do you have anyone you recommend in Arizona? Again, really, so there's very few of us in the world, really. I mean, there's like a handful of us in the world. I think there's probably going to be a few more over the next year or two. We're probably going to get more and more people that will start getting more interested in this and really try to get so that they're really focused on it. But there's very, very few people in the world who focus a lot on this. So in this country, very, very few, extremely few. So it's so the United States, very few. Canada, I don't know anyone offhand. And then Europe, there's maybe one doctor in Europe. Although he was saying that he wasn't going to be doing too much of it, last time I talked to him of it, because just there's a lot involved with it. There's a lot really with the recovery process, a lot of other things. So it's, tough to say really that what the community is going to have. I think that the new generation, though, coming up is starting to see what we could do, learning like how to do this properly. And I think we're going to be able to see over the next couple of years, a lot of people that are going to really take off. I'm starting to see actually like people are tagging me sometimes, even things like that. And I'm like, yeah, it's like a really good technique, really good way of doing it, things like that. And so again, they're abroad. And the reason why they're abroad, a lot of people are abroad is because overseas, internationally, people, a lot of physicians are more used to doing more manual type of procedures. And in America, these devices were just pushed everywhere. Everyone was pushed to buy a device. Everyone, as soon as you open up a medical practice, you get bombarded by these device companies. You guys just get like hammered by them. Left and right, they'll just try to come. And like they just want to get you to buy a laser. And it's like this like obsession that they have with, and they thought short term, these companies are falling apart right now. They thought they're falling apart. They sold their devices. First of all, they're selling it for way too expensive. They're selling it for hundreds and hundreds of thousands of dollars, some of these devices. And then they were trying to just throw it at anybody. So it's like, instead they could have actually had a really excellent product, really just for some physicians or so, that people could really understand the device. And instead they just want it so that here's like this financing thing, and they'll hook you up with a random financing company, and they basically have this arbitrary interest rate things that will just hike up. And these guys, over and over, I get messages from people that are falling apart. These med spas that are just like losing business, and they have devices. They have all these devices that they have to get rid of. So what happens really is, in this country, it's device focused. People are obsessed with their devices because they spent hundreds of thousands of dollars on their devices, and they're basically trying to use it on everybody. In every single problem they can run into, they're trying to use these devices. Whereas overseas, they don't really have that type of issue. Or internationally, they don't have these device companies like that as much. They don't have the lasers aren't as expensive as they are over here. They're like a lot of times a fraction of the cost is what we have to pay over here. And so they use their hands a lot more. They're using the laser as just an additional tool if they need to use it for the right patient a lot of times. So that's why internationally, a lot of things are actually a lot better with that stuff. And you'll see that like there's very few people in this country that are doing it. A lot of the guys over here are just going to push their lasers over and over. And then, what they did was they bought into the whole skincare line stuff. They were like, some guy came over to them and said that you really should need to have a skincare product line, and here, just put $100,000, $200,000, sometimes $1 million into your own skincare line, and now just like become a QVC rep and like start pimping it all day long. And that's what they have to do then. Of course, if you had to spend hundreds of thousands of dollars on your skincare product, your skincare line, of course you're going to like try to push it all day long, all the time. So it's like that's what ends up happening. So it's like in this country, in the United States, we have people that are just obsessed with lasers and obsessed with their own skincare line, or they're hooked up in with like another network of a skincare line, and they're just like forced basically to sell it because it just had a huge amount of inventory for that. Whereas internationally, they're using things like tretinoin and just like topical moisturizers like hydroquinone if they need to, things like that. They're not using all this other random stuff like out here. So it goes to show that like we got really like the short end of the stick because of like just how obsessed we were with like a lot of these guys with just trying to become like device salespeople. These physicians become device salespeople, and these QVC reps for like QVC salespeople for their skincare products. And now we're like so far behind. So hopefully the next generation gets a lot better. Can CO2 lasers burns be fixed? Yes, they can. Yes, I have fixed many. Absolutely, it can be fixed. These are not like death sentences, these type of things. Like they're not death sentences. You could actually improve it. There's ways of improving things. There's just a lot of times it involves more lasers, though. That's what's tough for people. It involves more lasers a lot of times. It's not like it's like a thing where you just just do a cream a lot of times. You do have to do a lot of times a laser right there. It's so interesting how Sophia is saying it's so interesting how few dermatologists address acne scarring. You're one of the only doctors I found that does phenol peels and a cure laser. Yeah, I found that you just have to focus on things. You just have to. In order to be really good at something, you have to focus on a few things. In order to become exceptional at something, you really have to spend the time to master those few things, and that's what you do. And you live and breathe it, and that's it. And like it's just impossible. Just there's so many things that you could just go into then, and your mind just gets like really confused, and you never focus on something properly. So really, that's what ends up happening, is that there's very, very few people that are just willing to just dedicate themselves to be focused on something. In order to be successful at anything, and all of you guys know, like at your jobs, things like that, that the people who are doing things that are very, very high level are people who are focused. And it's possible that you don't even see that at your workplace. And maybe that's why, like, you should wonder, is your workplace going to last today? Are the people really going to be focused on things? And if they're, they're not. If they're just jack of all trades, when I interview people sometimes, and I'm like, what did they do? It's like, well, I was doing a little bit of everything. Well, I don't know. Is it like that doesn't sound like a very well-run practice then, or something like that? If you're just doing everything, and like I don't know what that means. Like, why are you doing everything? Why is it that like you're not focused on certain things? Why is it that they didn't have you just like excel at something? You should just be allowed to excel at something. It's really fun, actually. It's really fun to excel at something. It's like really fun. It's like I want everybody in the world to experience that. Actually, it's an amazing feeling to actually just look at things and think to yourself that with your own willpower, with your own force of will, with your own hands, you were able to build something and do something, and it was you that did it. And it feels really good to do that. It's like, one of the best feelings in the world to have that over and over and over again. So if you could get that, I mean, do it, figure it out, get like focused on something and do that. And that's why a lot of doctors aren't able to do this, because they can't focus on something like that. And part of the reason why is because I really do think, I mean, it's really pretty obvious that our private equity world has destroyed the dermatology world. It's just destroyed it. It's gutted it. It's just like it destroyed Toys R Us and all these other restaurants and everything else that you used to love, all the chains you used to love. They bought them out and they just crushed them and they destroyed them. They bought it so that physicians who are seeing 20 to 30 patients a day are now forced to see 50 to 60 patients a day. Dermatologists are forced to see 50 to 60 patients a day. And they're shoved into tiny little rooms over there with a bunch of other people in there. They're crammed in there and they're expected to work at a high optimal level still. Imagine, how is that dermatologist now going to work on your acne even? How is it, they tell me over and over, they say it's very difficult to manage acne because they have someone else, a manager, a private equity dude, just a representative, a bootlicker, who's sitting there and telling them that they have to actually go do this, do this, do this, do this. And they're telling this physician that they have to do these kind of procedures. They have to do mole removal. They have to do this. That bill's higher. That bill's better than your acne, than your prescribing medication. Why are you just doing these things? Go do the mole removal. Go do this. Go do the cyst removal. We could bill better for that. And that's what ended up happening, and it crushed the dermatology world, and it's crushing modern medicine. It crushed it already. It's already done. That's the whole problem. That's it crushed the healthcare system, it crushed the hospital system, that's why you don't see private doctors anymore. You don't see any of it anymore. That's exactly the reason why. They destroyed it. So anybody that's sitting there and they wonder, why does my doctor suck today? Well, it's probably because of private equity. It's probably because of that. It's probably because they got bought by a company like Walgreens, for example, or some other random huge conglomerate that just bought something out randomly. And they just forced this doctor now to see from 20 to 30 patients to 50 to 60 patients. And now imagine the quality of care that you're going to get now. Imagine it. Just imagine what kind of level of care and what kind of dedication you're going to get now for that. It's impossible. You'll see over and over and over again in the chats and everywhere else, you'll see over and over and over again, people will say that I went to a dermatologist and they didn't even touch my skin. They hardly even looked at my skin. Over and over and over again. I've experienced it multiple times. My patients have experienced it multiple times. People in the chat have experienced it multiple times. And it's a story, think about it, over and over and over again. Even if you go to some top people, like great programs, great hospitals, things like that, and they'll say, oh, they went to this class, they went to Northwestern University, they went to Harvard University, went to wherever else. The same story over and over again. Over and over and over again. And at some point you have to look at this. Is it because all these doctors are just trash? Or is it because the system is just trash and it's just making these doctors put out this as output? What is actually happening? Is it suddenly that physicians have just become bad like that? Or is a system just really terrible? Sailor Moon saying OB-GYNs are getting bought out too. It's terrible customer service. No, absolutely it is. It really is. OB-GYNs are just like that. And they really have made it so that you could actually go to one OB-GYN and then they'll just hand you off to a random partner who never even saw you. My wife actually was giving birth over in Hoag Hospital. This was Hoag, Newport Beach Hoag. They knew I'm a physician. And, her really good OB-GYN, this was 2 years ago or so now, and her really good OB-GYN was pregnant, and then she handed it off to this male OB-GYN, and he just didn't give any pain medications. Yes, it was first of all a fight to get the epidural, and then you get the epidural, and then afterwards she's in an excruciating amount of pain, and he's just refusing to give any narcotics. He's saying that he's worried about the fact that you could become like a pain seeker or like an opioid dependent, and he's just like it shouldn't hurt. It doesn't hurt when the uterus, after pregnancy. I'm looking. I'm like, first of all, I'm looking at this. Like, do you have a uterus? Like, how do you understand this? What does this even make sense? And this whole system was like this. This is the modern healthcare system right now. That these guys now are just handed off. Like, you have no continuity of care. My patients over and over again will tell me when they do the scar treatments that they're doing it, and then they're having an assistant finish the scar treatment for them. They're having other people do the scar treatment. I'm doing this start to finish. I'm doing it from the beginning, finishing it for patients over and over again. I'm doing it. So I make sure that nobody can say that, it was due to something else. It's due to me. I did this. I take care of this. I take personal ownership of it and making sure that we can get there, get that amazing result for people. And there's a lot of people that will say, well, that's not good business. You could do so many more people. You could do so many more people all day long if I put more nurses and PAs, everything else that could do these things. And you should just train them and you could just do that. And then they're missing it. They're missing the whole thing. They missed the whole thing. They missed the whole point of all this stuff. The whole point is I hate that world. I hate it. It actually disgusts me. I hate the thing where you're just sitting there and you're just sitting there sitting behind a desk and I'm just outsourcing things. I love the fact that it's my own hands that does stuff. If there's people that are out there that could do things that are very, very high level, that I work with them and do it at a high level, that's excellent. But I don't believe in just sitting around and just having somebody else do stuff and myself just just smiling and getting the patient to go do that and then having someone else go do the stuff for them. I want to be able to do these treatments for patients and do it at a very, very high level for them. It's of course I want people to have different options, price points, and that's all fine for us. But when I'm doing things, I'm going to do this. I'm going to get you through this completely from start to finish here and go through that whole journey with this patient. It's going to be amazing. Ultimately, it's going to be an amazing, amazing experience. Just imagine what this patient's going to have at the end of his whole journey. And he's only 2 months out. It's going to be so good. It's going to be really good. Moo saying, can you get results after one time and have minor scars? This patient is just a single time right now. This is 2 months out after a single combination session. So yes, we could absolutely do that. It depends though on what you let me do, how much. That's what I'm partially saying though, is that part of this is I really trusted this patient really well too. He just knew how to do this and wanted to get the best possible result. It was just somebody that was just you just knew that we could get this, we hit it off and we could be able to do this. And it's we did it. So you come all the way over here. I don't know why you wouldn't want to just do things. Let me do it properly. It's just let me do it. Let me do it properly. If you don't want to let me do it, then I honestly feel you really should just go and do things elsewhere. There's other people out there that do things and go do it with somebody that's gonna sell you on a package and do it. And someone told me before, I don't understand. You're the only doctor that doesn't have this package of 3 to 6 sessions and stuff like that. Every other doctor said it. And so I'm thinking I'm going to go talk to some other people. I'm okay, that sounds fine. Go and do that because I do scars all day long and I know that not involves sometimes it's 2, sometimes it's 1 session, sometimes it's 2 sessions, sometimes it's 4 sessions. I don't know what the number is. And exactly your collagen response could be different. I could have an estimate for how much it is, but I'm not going to sell you a treatment package if I could solve a lot of this in 2 sessions. Why would I sell you 3, 6 sessions of this something? You're coming all the way out of state. I'm going to put it as my responsibility to get you the best possible result each and every time you do this. So it's in my mind every single time. I'm not sitting there thinking, I could just do this later. I'm just gonna go and do this next time. I'll just go ahead and fix this for this patient 3 to 6 months and he already bought a package and I'll solve it at that point. No, solve it right now. The patient's right there. Let's solve it right now. And I will solve it right there. So I'll do it right there. I'll take care of it right there. Let's just solve it. Let's try to solve as much as we could do safely. I'll solve it as possible, as much as we could do. And why not? I'm not going to sell you on a package. I'm not. And I do have a lifetime warranty program though. So after we do this combination session, now futures laser sessions for this patient is going to be 55% off. Future TCA cross sessions are going to be 55% off. So take a look. You can see that. That's nobody else is going to do that. I do that because I know I knock it out of the park. I knock it out of the park every time. What was used on his cheek? Tichin is saying, what was used on his cheek? Ablative CO2. Did you use erbium too? Yes, I did both, Tichin. And I appreciate you coming on, by the way, Tiffany. If you could actually let me know if you could, we could share your results at some point. I can't remember. Just remind me if you could or not, because your results are killer too, by the way. So it'll be nice if you let me share at some point. I know I'm not sure. I'm not sure if you let me or not. I can't remember. But if you did, let me know because we should put those together. Actually, your results are killer already. Actually, really, really good. And you're, I think, what is it, 3 months out or something like that? I saw you a month ago or so. So really good. Let's see here. Where's our thing here? I lost a lot. I had a lot of questions. Actually, I went way overboard tonight. I'm actually thinking, by the way, I'll probably still do. I may start going to doing less. Oh, no, it's okay. I won't say that though. I was going to say I was going to do less per week instead of Monday through Thursday, and maybe do a longer format. Maybe I'll do a poll of that actually. Maybe I'll do a poll of something like that where I do a longer format for once or twice a week instead of every bit of from Monday through Thursday. Soul is saying, bro, you take way too long on one question. Yeah, I take a long time with a lot of things. I'm actually very slow with a lot of things, actually. I go like very slow and steady. That's my whole point with this whole thing. The whole point with this thing is that this is a slower process than you may think. And sometimes part of what this is just that we're going to be slow with a lot of stuff, because it's just like, it's not, nothing's going to be fast. And really it's like, I'm on here for like, I like to help out and things like that. But it's not like I'm like, I'm happy to answer questions, but I also like don't have to answer your questions, if that makes sense, right? Like, it's like, I'm not like obligated to answer questions. I'm not like I have like some sort of contract here that like is obligating me to like answer questions. I'm happy to answer questions that people want my input on certain things. I'll be happy to answer it and help you out, but like, it's not like I'm obligated to, and I'm like able to answer some questions, and some people like are asking things that are very interesting to me that I need to answer right away, and some things like I already answered earlier, and I'll help you out in a little bit. So since you've been waiting, I'll get to your question here though. You said best for PIE or PIH, and what is the best thing? So topical that can fix it. So the easiest thing really is going to be azelaic acid, 10%. So I was saying, I graduated from Cornell in 4 weeks. I don't take this long, bro. So you're not, you know what? This is not the best world for you. This type of stuff. Cornell is kind of questionable sometimes, honestly. Honestly, it is. It is sometimes. Like, I feel like that's sometimes I've heard that kind of thing where people just really, really like have a lot of anxiety over at Cornell. So I hope the anxiety over there gets like better controlled for us, because it's like this type of thing. This is going to be a slow process. All that stuff is going to be slow. A lot of people say, wasn't that guy Andy from The Office from Cornell too? I think it was from Cornell, right? Andy from The Office. I think it was a Cornell guy. And like, it's sort of like, I think it was kind of like accurate. Like, a lot of the times I meet these Cornell guys and it's like kind of similar. So I'm not sure. Congratulations on graduating. I think it's awesome. But like, I think wasn't Andy? He was, right? Andy from The Office. Andy. I think that guy was like The Office, like was from Cornell, right? Yeah, I'm pretty sure like that was like the story. And like every time I meet that, it's like that. I appreciate it. Yeah, so yes, it'll be a patient level type of thing. But yes, 15% azelaic acid, you require a prescription. So just 10% azelaic acid over the counter, it should help you. Last question I'll answer here is, what do I think about microcoring? I think you could do it just with your own hands, but with the device, not going to help as much because it can miss the spots there. I appreciate everybody. Thank you guys all so much. Thank you so much, Sophia. Thank you so much, Georgia. I appreciate